going to show you how to put together and put on an e-collar on your pet. First, just to kind of go over a couple different versions. We have a few different versions that you can purchase at your hospital or over the counter in any pet store. There are more versions than what we have here, but these are just a couple. So they have the Comfy Cone, which is a soft padded e-collar that velcros together and has different sizes that you can make the headspace to fit on different size patients. Most of the time they do really well with this collar. The only downside, it is not clear so they can't see from side to side, but it's a lot softer and comfier than the typical plastic collars that you get in your practice. They also make these clear ones that velcro, and they're an easily slip on and slip off. Problem with these is that they're only one size, so you have to make sure that it fits appropriately to your pet before you buy it. And these are a style that can come off pretty simple, pretty easily I should say, and so it's not one that we typically recommend unless the pet is pretty calm. The one that you're typically going to get and see is this plastic e-collar that we put together and fit appropriately to your pet before going home. So we'll show you how to put it on and put it together in case you ever have to do that. And so the first step that I typically do is create your hole for your collar to go through or some gauze to go through to keep it attached to your pet. And so rule of thumb is you always start going in and come out. So you have your strap here with your little notches for insertion. And so you go in. These can be a little difficult when you first purchase them as they're pretty stiff, but they start to loosen up pretty quickly. So you go in through the top and then you push out and go out through the bottom. And this is going to create your collar to be able to fasten it to your pet. The next step would be to make sure that it's the appropriate fit for your pet. We want to make sure that it fits and does not go, that the nose of the patient does not go too far out, as it will defeat the purpose of putting an e-collar on, as they'll still be able to get around it and do any damage to the area that's affected that we need to keep the e-collar on, so they do not go for it. And so what we do is we just gently wrap it around just to make sure that you can see the nose isn't going to slip outside the rim of the e-collar. And so they shouldn't be able to turn their head and get at any area that they're needing to stay away from. So we know that this is going to fit appropriately on him. And so now we need to make sure that we fasten it to a size that's going to fit appropriately. So he's got a pretty small neck, and there's 3 different options for sizing that you can go to. So I'm going to go to the farthest one. And again, you go in and then through the top and out through the bottom. And this will just click into place and it'll be fastened together. So now this collar is ready to be placed onto the patient. And so you can either put their collar through the top here, or you can take some rolled gauze and make your own collar to be able to tighten it to the level that it needs to be. So it just goes through here. And you don't want to make sure you have too much extra string on there as it could get caught on something. So now this just slips right through their head. And sometimes it can be a challenge. Make sure that their ears are through. And then you would tie this in a bow to make sure it stays on tightly. And now he's got his e-collar on.